Now from Albany, where the use of our tax dollars is under discussion, with state lawmakers now reviewing Governor Hochul's $252 billion plan.
As expected, Medicaid is listed as the biggest part of that $15 billion increase in state spending. Channel 2's Ron Plants focused on a budget hearing on that costly subject and concerns about possible cuts in Washington.
From the state capitol to the nation's capital, advocates fear Medicaid is in the crosshairs of a GOP-led Congress.
The target of saving over $2 trillion from Medicaid is 30% of Medicaid spending projected over the next 10 years. So if they get anywhere close to that number, that is a very dramatic cut to our state in particular.
That is because the federal government was expected to cover $70 billion of the overall projected $123 billion total of Medicaid spending in this state. The new budget proposal puts the state share at $44 billion. So with concerns of a Medicaid budget hole, state government health care officials pressed on what the Empire Center Government Watchdog Group claims has been a 60% increase in Medicaid spending in the past 3 years, especially eligibility, including undocumented individuals among the 7 million enrolled in Medicaid. State Medicaid Director Amir Bashiri said there is income and household verification, but this exchange.
Can you tell me about if we have people that are not eligible for Medicaid that are on Medicaid right now, and how many that might be?
I can't answer that definitively. I mean, we did cover, as part with legislative support, we did expand coverage to the undocumented 65 plus population to have comprehensive coverage. There are many people who are undocumented who are eligible for emergency Medicaid.
I just see a lot of correlation between not being able to answer that question on nearly 1 million people's eligibility and the fact that we've had such a dramatic increase in the last 4 years.
The Empire Center threatening a Freedom of Information lawsuit on getting those details, but back to a federal government impact on state Medicaid cost.
Could you imagine what's going to happen when we get to Medicare and Medicaid? Okay, so I need your help again. I need Republicans, I need Democrats, I need you all to work with us to fend off this problem.
At that hearing, there are also many lawmaker questions about the state's April 1st deadline for a managed payment transition to the Medicaid-funded program, which you may have heard of allows a disabled or elderly patient to arrange a caregiver for home care. Concerns about confusion on the ability to meet that deadline, but state officials confident about that. On your side, Ron Plants, Channel 2 News.
All right, Ron.